Good morning. Thank you to the ABC leadership for the invitation to be on this esteemed panel, and my sincerest condolences to Dr. Williams. The fundamental recognition of being a human being, the bedrock of human rights, was ignored when we all watched Mr. George Floyd state for a long 8 minutes and 46 seconds, "I can't breathe." It also ignored and is also ignored whenever you see the snapshot of an amputee that was probably never given a fighter's chance to live a productive and healthy life. Their hourglass of life turned upside down with 80% dead within 5 years of their index major amputation, 3 to 5 times likely to occur if you're Black, independent of your socioeconomic status. Anti-Blackness lies at so much of the core of what's problematic in our society today. Injustice anywhere is a threat to justice everywhere, as Dr. Martin Luther King said. And as a Black interventional cardiologist and the only Black limb salvage specialist in the Mississippi Delta, I currently make up less than 1% of the population that Dr. Albert referred to in her introductory remarks. I performed a limb-saving procedure on a 49-year-old Black mechanic who had diabetes and was on dialysis early in 2015 when I moved here to Mississippi. The surgeon had also been consulted on the case. The patient had a non-healing wound on the same foot that required a 2 amputation 8 months prior to my arrival. Our procedure was successful, and I texted the picture of the final angiogram results to the entire team caring for the patient before I left town for the weekend. Shockingly, by Monday, I found out that leg had been amputated. I have agonized over this case and the patient and his family, who suffered in isolation until his death last year. It was that poignant moment that I truly grasped the need for the defense of humanity and justice for our vulnerable population, and it became a personal mission with heightened urgency to be a voice for those who lack the megaphone. In the recently published ProPublica article titled "The Black Amputation Epidemic," we highlight the amputation lottery map, the map of the Black Census-Scope of America. The same map has the highest rates of patients with risk factors for peripheral arterial disease and other polyvascular diseases. The Mississippi Delta has one of the highest amputation rates, the lowest number of revascularization procedures to salvage limbs, the lowest number of physicians per capita, and the highest burden of chronic health diseases in our country. Mississippi is currently the poorest state in the U.S. today, but once was the 4th largest economy in the world in 1860, with cotton being king. Mississippi had more slaves than any other state. In fact, an enduring legacy till this date of having a Black population of almost 40%, majority of whom reside in the Mississippi Delta. So PAD remains the most prevalent, debilitating, deadly, and costly pandemic that most have either neglected or never heard of, affecting 21 million Americans and disproportionately killing all Black and brown people. If left unchecked, leads to 200,000 amputations, 65% of which are due to diabetes. African Americans are 65% more likely than whites to be diagnosed with diabetes. Every 30 seconds, a limb is amputated due to PAD or diabetes. Diabetic patients present more with late stage that wound heal without intervention or an angiogram. An angiogram decreases the odds of a major amputation by 90%, but 90% of African Americans in this state have never been offered this option, with the national average being 50%. In terms of the landscape of the peripheral vascular space, there are limited content of addressing health disparities at major pharmaceutical and device-sponsored societal meetings. There are limited endorsements of preventative statements that could stop perpetuating disparities in screening, treatment, and outcomes. Limited access to quality care and insurance, and no incentives for cardiovascular specialists to independently come to these underserved areas and thrive, with refusal to expand Medicaid, adding fuel to the fire. Despite the fact that 520,000 Mississippians are uninsured and 750,000 Medicaid recipients are burdened with all the chronic diseases or risk factors that end up in amputations, Medicaid does not cover prosthesis in the state of Mississippi. It puts a chokehold on the visits to specialists, with endocrinologists mainly not accepting Medicaid, and puts a stifling quota on the number of medications covered. These are all patterns and practices that devalue and dehumanize the Black and brown individuals across the entire spectrum of healthcare, with the proverbial knee lodged in the neck of minority people. The knee is constantly and systematically kept on our necks. We can't breathe. So the disturbing practices of offering an amputation-first treatment strategy must end. The cost to our healthcare system is close to $380 billion a year. It's also a burden to our workforce due to the loss of productivity. Majority of the burden paid for by taxpayer dollars, all on this call today. Multiple studies have shown that early screening, implementing effective medical therapies, and timely performance of revascularization in critical limb ischemia leads to limbs and lives saved. We've shown this by decreasing amputation rates by 88% over a 4-year span. This fight has led to policy action, realizing it would take both education and legislation to regulate behavior. Morality cannot be legislated, but behavior can be regulated. You may not love me, but you will not chop off my leg. Addressing key modifiable risk factors, improving access to quality cardiovascular care, addressing social determinants of health are all long-term strategies that are key salient first steps. But legislation is needed to control the external effects of bad internal attitudes, restrain the heartless. So my hat's off to Congressman Donald Payne Jr. and Congressman Gus Bilirakis, who recently established the first ever bipartisan PAD caucus, working with the ABC at the helm of these efforts to support legislative activities to improve PAD research, education, and treatment. The bill will demand Medicare, Medicaid, and commercial coverage of PAD screening for at-risk patients, vascular screening of at-risk patients based on ACC/AHA guidelines, disallowance of non-traumatic amputations without documented anatomical testing, and development and implementation of quality measures that incentivize multidisciplinary approaches to treat this disease. In conclusion, we will continue activating, agitating the levers of power for things to get better. We have a mandate, a righteous indignation. Just as the systems in our body work in harmony, so too should our healthcare system, our government, our schools, financial, religious institutions, and community stakeholders. Focus on the future of our people with thoughts of our course of actions to make their dreams come true by any means necessary. Be the change. Equality matters. Thank you.
Thank you, Dr.